I'll introduce myself since I didn't fully. My name's Adam Herman. I'm a paramedic. Been out on the streets for going on near 20 years. I'm a CPR instructor, advanced cardio life support instructor, trauma instructor, medical support instructor, pediatric instructor, geriatric instructor. So I run the gamut. I'm also a critical care medic. So I've been doing this for, like I said, going on almost 20 years. We're going to go over some CPR. I'm going to figure out, most of y'all have already had CPR at some point in your life. It's pretty simple. You put your hands on and you push on the chest. That's it. You put your hands in the proper place in between the chest right here, and you start pushing, and you don't stop till A, help arrives, or B, you can't push anymore. That's how to deal with cardiac arrest. Whether they heart stops because of they're ill or for whatever reason, they're old or whatever. Their heart stops, they're not breathing, they're not moving, you just push on their chest. Plain and simple. You don't worry about breathing in for them, because the body will, there's enough oxygen that'll circulate through, and there's enough oxygen that will, just be brought in because of the fact that you're just pushing on their chest, and the lungs are kind of like balloons, so you compress them and they re-expand. So that's CPR in a nutshell. Okay? Push until they either wake up. Now, if you start pushing on their chest and they make a sound or they move, please stop.
Wake up, man.
Okay? We have had instances recently of people pushing on chests and they're screaming, stop, stop, and they're still putting.
No, it's for your own good.
Please, if they move or they make a sound.
Probably that door was jammed.
Should be open.
Yeah. Just need to put some
There
meat
you
easier.
go.
Guess you got
Put
it.
some asphalt.
Hey,
What's
this
going
is
on?
time. We're
How
just
you
getting
guys
started.
doing?
Just been trying.
Here, let me move out of the way back here.
So, but if they move, they make a sound, please stop. Okay? Plain and simple. Now, in a traumatic arrest, which is a lot of the things you may see up here if you're riding in a group or you see something happen, or even a car accident. The chances of survival for somebody who their heart stops in a traumatic arrest, it's pretty much slim and none. Okay? 3 to 5% maybe survive a traumatic arrest. And that is with help there immediately. Why? Because in a traumatic arrest, the heart stopped because of trauma. You'll have internal bleeding. If an aorta ruptures, the vena cava ruptures, that's 3 to 6 seconds and you've bled out. Okay? Cut a femoral artery, cut a carotid artery, that's 3 to 6 seconds of bleeding and you're dead. Okay? Hypoxic brain injury, there is no coming back from that. Okay? Internal bleeding in the abdomen, 10 to 12 seconds. Okay? So a traumatic arrest, the chances of somebody surviving that are pretty low. And if you're riding in a group up here in the mountains, if they're in traumatic arrest, the chances of them surviving are even less. Because in trauma, what the patient needs is they need a surgeon. They don't need a bystander. They don't need a medic. They need a surgeon. And the chances of a surgeon being out here on these roads are pretty slim. Okay? You wreck in front of the hospital at 75 going northbound near Kennestone, and you're in traumatic arrest. By the time I get you to the hospital into that ER, even with the surgeon standing there waiting, chances are you're not going to survive anyway. It's a fact. It's a fact. Okay? Yeah, it sucks. It's grisly. It may give you nightmares, but this is the facts. Facts are, people are going to die because they're wrecks, bike wrecks. They do something silly. They think they can. How many of you know somebody who overrides their bike?
Mm-hmm.
Right? And how many of us, when we first started, overrode our bikes?
Never.
Never, never.
Most people I know override themselves.
Right. Well, they get on this bike, this fancy bike, and they're like, oh yeah, I can do this, and they're done. You know? I can tell you the night I had my accident, I wasn't overriding. Just got hit by somebody who was stupid. And I was where I was supposed to be. My bike was found in first gear. So it was a Sportster, and I was found in first gear. And yeah, when you find a bike in first gear, it's a 1976 Sportster, it's only doing what, 20?
Maybe.
Maybe miles per hour. I was in the turn lane. Right where I was supposed to be.
Right.
She just wanted to be there more than I was. Okay. So that's pretty much trauma. Blood, on CPR, air goes in and out. On trauma, blood stays in and circulates where it's supposed to, not into the cavities of the body. All right, we can go home now. Done. All right, see you. All right, so I'm just going to play some adult CPR. Just let y'all see really what it is and how it works. It's pretty B-movie-ish, if not D-movie-ish. Okay? And I'll talk over it as we go. But yeah, the best way is like, if I'm standing here talking to you and you'll know somebody when they go into cardiac arrest. How will you know? Well, A, they're going to start sweating profusely. They're going to turn gray.
Sudden cardiac arrest.
They're going to start complaining of really bad indigestion. Okay? It's like, God, it just, don't feel right. They're going to grab their chest because, and then they're going to fall over. They're going to not be breathing. You won't be able to find a pulse. They're not going to respond to you. Okay? You can shake them, you can kick them, you can punch them. They're not going to respond. Okay? At that point in time, what you'll do is once they do that, I don't care where you are, who you are, whether they be male, whether they be female, you have to expose their chest. Okay? You have to pull it up, pull it off, cut it. Okay? You have to get to the chest because you have to be able to find the very bottom of the sternum. There's a little piece right here. It's just a piece of cartilage. If you push on that, it breaks. So you want to feel that little piece, roll up, there's a little indentation. Right above that indentation, there's a hump. You want to put your fingers right on that hump, and then put your hand on it, and then just start pushing. Okay? You might feel as if you're breaking ribs, but what you're initially doing is popping the cartilage from the sternum to the ribs right here. They're attached by cartilage. It's like popping your knuckles, except you're separating that cartilage right here and releasing the nitrogen. If you're continuing CPR, yes, you might break a rib. Yes, there may be a lung puncture, but we can fix that.
Right.
But we can't fix the brain damage, we can't fix the death of the organs. So you have to pump on the chest, you have to pump deep enough. You have to pump at least 2 inches down. Okay? 2 inches, that's a good amount of the chest. 1/3 of the chest in most people. Okay? Everyone here is about 1/3 the chest. This is a group that you're not going to find a 500, 600 pound patient with. Okay? If there's 500, 600 pounds, I'm sorry, there's not a damn thing you're going to be able to do. You can't even get a rhythm on a monitor doing compressions on a 500 pound patient. I don't care who you are, how big. You must have to be at least as big as they are to push that hard. Sorry. It's a fact of life. I'm pretty brutal when I teach, by the way. So if you get upset, I'm sorry. But I'm pretty brutal. I tell the truth. It's the way it is. Okay? So anyway, 2 inches, a third the depth of the chest, you have to push. Okay? What you should be able to do is as somebody's doing good compressions, you should be able to put your fingers right here on their carotid artery and feel the pulse. If compressions are being done good enough, you should feel the pulse. The moment you stop compressions, the pulse goes away. Okay? Or if I get there and I put it on my monitor, you're doing compressions, I'll put my monitor on. I should be able to see a good pulse on my monitor if compressions are being done properly. Okay? All right? 100 compressions per minute. There's 2 songs you can sing. One is appropriate, one is not politically correct. Okay?
Welcome back.
That's what. Appropriate is, when politically correct is staying alive. Not politically correct is another one bites the dust. Okay? Those are 100 beats per minute. So you can sing either one of those songs in your head to 100 beats a minute. Okay? You're not going to do breathing like these guys are. I'm teaching you hands-only CPR.
Why did they stop the breath?
Because, again, we talked about that when you're circulating blood through the body, oxygen, 100% of the oxygen is not dropped off the red blood cells as it circulates through the body. It only drops off maybe, 1/4 to 1/3 of those oxygen molecules from each red blood cell initially as it circulates the first time. Okay? So you have, 70 to 80% of oxygen molecules still attached to that one red blood cell, and as it travels around the second time, as you're doing compressions, it will offload more. Okay? Now, lungs, again, like I said earlier, they're like little balloons, okay, on most healthy people. If you take a lung, pull a lung outside of a body, it looks like a balloon. And if you squeeze it, it automatically refills. Okay, just like a balloon. If you squeeze it, it'll contort, but it'll fill back, it'll go back to its original shape. So as you push on the chest, you're not just compressing the heart, you're compressing the lungs too. So you're just going to get, as you compress the lungs, you're going to force air out. And as they refill, they're going to automatically just draw air in, oxygen at 21%. Okay, so they're going to be drawing in 20% oxygen molecules to reattach to the red blood cells as you're circulating them through the body if you're doing appropriate compressions. Okay, so if you're doing those appropriate compressions, you're still circulating oxygen. You're keeping the body alive. You're keeping the blood flowing. You're oxygenating the kidneys, the lungs, the liver, the pancreas, the brain. Okay, they're not getting enough, mind you, but they're getting enough to keep them alive that if it's done right and appropriate measures are taken within a fairly short period of time, like drugs and electricity that a patient may need, they can come back and walk out of the hospital.
Question. So, can you do this indefinitely or have oxygen indefinitely?
So, if you are doing CPR for more than 20 minutes, the chances of somebody surviving that are pretty low. Okay? They're pretty low. So if you think about it, if we're down, in a suburban type environment, okay, or even a somewhat rural environment, not out here. This is not rural. This is out in the middle of nowhere. but but a rural environment where you have fire station. Where's the closest fire station here?
It's on the.
Frogtown?
Frogtown. How
Well, no,
far?
actually 129.
No, Frogtown, because 129 is White County.
15
Oh, that's right.
Okay.
Yeah, you're right.
10 to 15 minutes away, and it's probably a volunteer fire department.
Yes.
Yes, it is.
Okay, so by the time the volunteers get the message, get to the station, get here, you're looking at 20 minutes.
And then they gotta get here again.
Right. So, but you're in a suburban environment or a semi-rural, like I work in Paulding County, West Georgia area. And we have areas like this out there too. Don't get me wrong, there's some out in the middle of nowhere. It takes me 40 minutes to get there from where I usually sit. Okay, it takes our firefighters at least 12 to some of the areas we go to. And then you got to drive 2 miles into the woods to get to the house. So yeah, it's still far out. But in a suburban and semi-rural environment, your response time is anywhere from 6 to 8 minutes.
This is the dispatcher.
Okay? In that 6 to 8 minutes, I show up, I can give drugs. If their heart's, functioning erratically, I can apply electricity. Okay? I actually have oxygen. I have, again, like I said, multiple drugs I can do, multiple things I can do that, out in the field, just a layperson can't. You don't carry epi, you don't carry bicarb, you don't carry, calcium chloride. It's just not available to the lay people. Okay? Even a doctor out in the field, he doesn't carry all that stuff. So there's not much he can do either.
I'm sorry, you do or do not carry it?
On my truck? Oh yeah. You don't.
Right.
You guys can't carry it, so you can't get, well, unless you have an EpiPen. But even that 0.3 is not going to do anything. I give 1 milligram, not a third, not 0.3 tenths of, 300ths of a milligram with an EpiPen. So an EpiPen's really not going to do much anyway. Okay. Yeah, unless you have a bunch of them just start stabbing all over. Yeah, there you go, bam. I walk up and there's 10 EpiPens. Wow, look at that. Yeah, they bet, they be, so, but if you're, so I'm gonna say, if you're out here, somebody goes down, y'all just talking, they have a cardiac arrest, and you're doing CPR for 20 minutes, chances are they're not gonna make it. Unless, once you start doing those compressions, they turn around and they start moving and talking right away. Okay, because that does happen. You ever see those old movies where they go into cardiac arrest and they just go, bam, and hit them really hard? Okay, that's the truth. It actually works. Because when I first started doing this, we still did those precordial thumps. Okay, and I put somebody on the monitor and he was talking to me, and then all of a sudden I saw that. My first instinct was to go, bam, and hit him as hard as I could. It worked. He lived.
How many ribs you break?
Yeah, we won't talk about the bruise I left on him. But he was grateful for that bruise.
I'm sure.
Okay, but by the time I could have got my monitor on and shocked him, I'd already hit him and delivered a shock. Okay, to that heart.
So is that no longer done?
Because, especially for lay people, you don't know what rhythm that heart's in. You don't know if that heart's just sitting there quivering or if it's just dead. Okay. All right. So I don't recommend doing that. And even with these, who's got an Apple Watch? And everyone's got a smartwatch. I even have one. I can't function. See, it won't even turn on for me. And it's supposed to turn on when I flip my wrist. And electronics don't work well on me. But you ever look at your heart rate on it?
Sure.
Did you ever look at your heartbeat on it?
Sure.
Okay. Next time you're in a hospital somewhere there's I want you to look at that heart rate and have them hook you up to their monitor and see if it looks the same.
Yeah.
It doesn't.
No.
Are you okay? Are you okay?
Doesn't look anything like each other. Now it may come close, don't get me wrong, but it doesn't look what I can see on my piece of equipment.
No one comes to help, and you have some.
All right, maybe one day we'll have that. Maybe one day, you know, Bones will come up and go, yep, no, you're gonna die tomorrow.
Next,
No, got the reference, did that.
5 to 10 seconds. Check
Star Trek.
Thank you.
I was thinking of one.
Bones. I mean, you're old, you should have gotten it.
I'll say that.
You know, they had those little tricorders where they could read you.
Yeah.
You remember those? Star Trek.
Yeah, it's coming. That's-
It's coming. I mean, it's close.
Yeah.
I mean, the monitor I carry is $10,000. Okay, it's a life pack, and I can do everything in my truck. I can do everything the hospital can in their ER room for a cardiac arrest, except do a cath. Okay, but that cardiac arrest, until I can get you back, I can do everything that ER can do. With drugs, with electricity, with monitors, with fluid, with IVs, everything. Okay? It's all done. All right? Of course, this is still playing in the background. So between me overdoing it. I get excited because I like to teach. I like y'all to know. Y'all, this is good stuff for y'all to know. Okay? So we're doing the CPR, all this stuff done.
Check to make sure the scene.
You find somebody down, and like I said, out here you're riding, you're a group. You're out here, you sit there, like you said, you respond to these wrecks. From sitting there, standing there taking pictures, right? How long does it take you to get real help there?
Are you okay?
I mean, it could be 20 minutes or 40 minutes.
If
You don't
someone
know,
comes,
right.
have that person.
20 minutes. On that guy who's cardiac gone into, look, he could have had a cardiac arrest before he wrecked the bike, for all we know. Don't get me wrong. Even you youngins, okay?
Younglings.
Younglings, you know, anyone under 40, 30, we'll go there, you know.
I'm 30.
Yeah, I mean, you can have a cardiac arrest. We don't know.
Oh, yeah.
I mean, I have worked cardiac arrests as young as 20 years old with, you know, with people because there's a congenital defect that we didn't know about somewhere along the way. Or they get dehydrated. You know, they got sick, and then, oh, I feel fine today, and they go out and do stuff, and they exert themselves, they go into cardiac arrest. Okay? You know, or, you know, think about this. You're out playing somewhere, you know, you got this big old bruise on your leg, you know, and that blood, you know, piece of that dried blood breaks off and goes into your veins and your arteries, travels to your heart. Stops your heart. Okay? But you're out here, you don't know why they went into cardiac arrest unless you can, you know, you see them have that traumatic wreck. But again, 20 minutes, 40 minutes to definitive help. You know, you can stop the bleeding, you can, you know, do CPR for as long as you can. Now, if it's just you and nobody else, you do it as long as you can. Till help arrives. Till somebody comes. Till somebody comes to relieve you. Okay? And if somebody comes and they don't know what they're doing, you have to stop, you have to teach them, you have to tell them what to do, you know, and, you know, do the compressions. All right? Watch it, look for any bleeding. Biggest thing is y'all wear full face helmets when you ride? Oh, have you ever taken one of those full face helmets and thrown it down at the ground as hard as you can?
Yeah.
I did wear it.
What does it do?
Cracks like hell.
And it bounces.
Yes.
And it bounces. So what happens when that head hits the ground? It bounces. And what's holding that helmet up?
Your neck.
Your neck. And this is your neck. About this big, maybe a little bit bigger. And inside that neck is this little cord, say maybe about thumb width, okay? But when that breaks, that neck breaks, snaps that cord. Okay? I mean, that, you know, and then traumatic wrecks, that's the biggest thing right there is neck injuries. Okay? Because once that cord snaps, the brain doesn't, you know, the body stops responding. Okay? The body stops breathing. Hang on, watch out.
Look at the cat dragging.
Interrupting.
So, you don't know what happened internally, because, you know, if you see that much damage to that helmet, you should assume that there's a neck injury. Okay? All right? Don't try and take the helmet off. If their head's cocked like this, the best thing to do is not hold it in position, but take your hand on the base of their neck and pull it and support it into a neutral inline position. Okay?
So you would realign it gently?
Yes, gently and slowly. Now, if you start to move and they start screaming, stop. Just stop.
Yeah.
Okay, now I gotta do this. Snap.
See ya.
See ya. Wouldn't want to be ya.
Yeah.
But slowly start moving it into an inline position. Okay. Now, it's funny. This gentleman right here, he's got this fancy bag. It's actually got a C collar in it. Wasn't it? No, that was the police officers that we were talking about.
Yeah,
But there's not one in it. But if you have a way to support the neck, towels, rolls, something that you can wrap around the neck and hold it. Now, once you bring that in line, you're stuck. You hear me? If you're the only one there, if you're the only one there helping them, you're stuck. Don't let go of that neck. Hold on to it. Because the moment they move, they could sever their cord, more bones broken. Okay? Don't stay right where you are. Which means if they're bleeding from their leg and they're squirting blood, you know, what do you do first?
Yeah,
Okay?
so triage, priority,
Priorities.
that'd be a key.
Right. Priorities on the patient. Okay? You walk up, they've wrecked, they've done the 360 tumbles 50 to 100 yards down the road. Okay? They're laying there. You see a pool of blood somewhere. You find that pool of blood. You put pressure on it. You grab something, you know, in this day and age, you don't know. If you don't know them, or you really want to put your hands in their blood? Yeah, or nay. If you don't know them.
Gonna put your fingers in your mouth.
You know, I mean, if you don't know them, that's why it's like, you know, CPR now is really, they've gone away from mouth to mouth. Nobody does mouth to mouth. I'm a medic. I'm not even gonna do mouth to mouth on you. Okay, because, I mean, you know, there's, no offense, there's shit out here that don't wash off. Okay? When I come in, I'm wearing gloves, I'm wearing a mask, I have equipment, I have, you know, a shield, I have you know, a bag to use on you. Okay? But I also ride too.
It takes nothing, just a couple extra pairs of rubber gloves into the inside pocket on your leathers because it takes up no space and you never know when you're gonna
That's
need it.
right. How many boxes of rubber gloves you got in here, Vinny? Vinny, how many boxes of, oh, okay. How many boxes of rubber gloves are around here? Probably at least 2 or 3. You know, grab some. They're cheap. It doesn't matter what it is, even if they're just, you know.
I use them to cut up chicken, so I definitely
You
put
know,
them in my pockets too.
I mean, I go buy them at Harbor Freight because working on, you know, the lawnmower and it's greasy, you know, and I work as a medic. I mean, I hate, well, how would you like it? I mean, those of you who are mechanics who work with your hands, even so, do you want me to walk in and start working on you with these greasy, nasty hands and fingers?
Right.
You know?
I'm
I
not
mean, you know.
Yeah.
Hey, you know, if you're a mechanic, yeah, but if you're a mechanic, it don't matter.
If it's gonna save my life, I'm going towards nasty hands.
Yeah, right. But you know, I mean, either way, I mean, I've had. Don't get me wrong. I walked in after working on the bike, the boat, or something, and my hand, you know, grease under my finger. What are you gonna do?
But the other thought is we're all usually wearing gauntlets or some kind of gloves anyway when
Right.
when we pull up on a scene anyhow because we're
Now,
geared up.
I'm old, so when I get out, I have usually 2 or 3, you know, this is how my service works. I have 2 or 3 firefighters that show up on scene with me. I have my partner, and they're all wearing gloves. And they go to lift the patient, and they're like, "You can help?" I said, "I'm old, I'm broken. Come on." I direct. I'm a director. I'm not I'm not the actor. I'm not the hands-on. I'm a director, you know, and producer, you know. So I get my firefighter stuff, but I still wear gloves. But pair of gloves on, okay. Worst case scenario, most everyone's wearing leather. They're wearing a shirt. You know, we all carry knives. Who here doesn't carry a knife? Right. You know, I mean, I just picked up a new one the other day at the fishing expo. Really nice knife, handmade. So I've got at least 2 on me at all times. Cut a piece of shirt off. Cut something off. Stuff it in the hole. If there's a hole, stuff it in there. Why? It'll stop the bleeding. Okay? Now, if you just wrap it around the outside and put pressure on it, and it's bleeding on the inside, that ain't gonna do anything. Stuff it in the hole till you can't stuff anymore. If that's a dirty shirt, that's fine because we have antibiotics for that. You will get IV antibiotics the moment we get you into the ER. Okay? But stuff something in that hole. Now, if it's an open cut like this, okay, take that piece of shirt or that belt, okay, on here, we've got a tourniquet. These are fairly cheap. Okay, $5-6. But this will save a life for a near amputation. It'll save a life for a femoral, you know, for an artery cut in the leg. It'll save a life if you know, the brachial artery's cut right here. High and tight. Okay? Everyone says, well, what if the wound's down here? High and tight in the joint. Why? Because that is where the artery is closest to the surface. If I've got bleeding out from here, I'm not going to put it in the middle of the bicep. Why? Because that artery is surrounded by muscle and tissue. This tourniquet's going to do me no good here. It's going to do me better served here. High and tight. As high up as you can get it, and as tight as you can get it. And whoever you're putting it on, it's going to hurt. They're going to cry. But you're going to save their limb. They can stay on anywhere up to 3 to 6 hours now.
Oh, wow.
It used to be, you know, they'd say, oh yeah, release it every 20. No. Once you put it on, the only person who should take it off is a surgeon.
This is only if you can't control the bleeding otherwise.
Anytime there's bleeding that can't, you know, that's severe enough that pressure is not working
So
well.
we're talking about arterial.
Or even massive venous bleeding, okay, you still have to cut off, okay? Massive venous bleeding is going to be, you know, pretty significant, you know, damage to the muscle and tissue, okay? But you can usually stop that. So, like I said, arterial is mostly it, okay?
Does it not damage the limb, like having almost
So-
no blood flow?
We can restore that damage. So what happens to let's do a little bit anatomy and physiology and pathophysiology. Okay? What happens is I put this tourniquet on, all right? The blood inside that limb is going to develop lactic acid. Okay? Because it's sitting. We call it what's called a crushing type injury. That blood's just going to sit inside that limb, and the lactic acid is going to build up because it's not circulating. The CO2 is going to build up because it's not circulating. We have drugs for that. So when we release this tourniquet, okay, we're going to give high doses of sodium bicarb, okay, to alleviate that lactic acid. We're going to give calcium chloride to alleviate that CO2 buildup, okay? You may end up getting a little tissue death, okay? But you'll still save a limb, okay? The options are bleed out and die, save the limb, use a tourniquet, possibly lose the limb if it's, so if it's multiple hours to get to definitive care, yeah, it's possible you can lose the limb. But at the same time, you're not losing life. You know, their prosthetics are pretty damn good these days.
Yeah.
Do I really want one? No, yeah, I'd probably rather, you know, rather not.
Depends on the upgrades they give me.
Yeah, I mean, you know, look, when I had the broken bones in my foot, there are days way back when I wish they had amputated the damn foot because it hurt so bad. All right? But, you know, but any given day, I still have my foot.
That's right.
It's still my foot. It's not, you know, somebody made me a foot. Okay? So tourniquets. These tourniquets are great. Here, 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 and here. It just depends on if you like them or not. Do it like this. Yeah. I said, it just depends on if you like them or not. If you don't like them, then you know, hey, you use it as you see fit, you know? Okay?
Hey, Vinny.
All right?
Would you mind handing me that ball? Would you mind handing me that ball?
Thank you. So, these are great.
Yeah. You can leave those here too.
I don't recommend you take a pair and do it, but this will cut a penny. It will cut a nickel if your hands are strong enough. It'll cut a quarter. You'll need to replace your scissors afterwards, but it will cut that. Ladies, I'm sorry, underwire bras, pop. They're expensive, but it'll take it out. It'll take out a leather belt. It'll take out a
suit.
huh?
It'll cut a leather suit.
It'll cut a leather suit. It'll cut a leather boot. Okay, these shears are designed to do that. Okay, and that's why they're, you know, angled the way they are, to give you more leverage. But you have to expose. Okay, if you see bleeding, you assume there's bleeding externally. You have to expose that patient. Okay, I'll tell you what. I don't carry scissors on my truck. This little knife has cut more clothes off of men and women than I'll ever count. Okay? It doesn't cut leather belts and anything, but it's cut more clothes than I can tell you. You know, my partner was always yelling, "You're gonna cut them!" Yeah, watch this. I don't like carrying stuff. I don't like carrying scissors. That's why I have partners who carry scissors. Hey, cut the clothes off for me. But if you carry a pair, you can go get a pair. You can get them online on Amazon. You can get a whole 10-pack for like $6. Throw a pair in your, and they're great in the kitchen. They cut chickens up really well. They do, because they're designed to cut through anything. Get a 10-pack. Throw a pair in your bike. Throw a pair. Okay, so that piece of rope. Now, on this, he's got what's called an IFAK. Okay? It's a first aid kit made for me. For me. Not for you, for me. I carry an IFAK in my car for me, in case I need something. I need blood stop, I need a chest seal, a tourniquet, a compressed gauze. We've all been hearing recently of these road rage incidents down in the city. Okay? We had a shooting the other day. Somebody got shot on a road rage incident. You know, we actually had this kid. He actually had some stuff in his truck. He had blood clotter. He pulled his and he put it on him. You know, because he got shot in the arm. Stop the bleeding. Okay, that's for me. I carry spares for you. Okay. Now, if you're riding with your buddy and your buddy doesn't have one, and he wrecks, and you're in a safe spot, you might consider using it on him, right? You might consider letting him, you know, have a little bit of like blood clotting and gauze and stuff. All right, using a tourniquet on him. All right, but if you don't have 4 tourniquets, 1 tourniquet, you know, may, but you should always have at least 4. Why? Because you got 4 limbs. If the damage is bad enough, you've damaged 4 limbs, you're gonna need 4 tourniquets. Okay? But this is a chest seal going down the road, trees on the side of the road, right? Puncture wounds. This is good. This is a chest seal right here. All right, how do I know when to use this? Okay, when that wound in the chest is a hole and it's bubbling. If it's not making bubbles when they breathe in and out, you don't necessarily need a chest seal. Okay? What that bubbling tells you is that one of their lungs is popped. Okay? And that air is escaping from their lungs and filling up the cavity around their lungs. And eventually what will happen is that enough air gets in there, and it'll compress their lungs so that they're no longer able to breathe. This right here is great if you carry one. If not, you can use a piece of a bubbling wound anywhere in the chest, front or back. Get a piece of saran wrap. Okay? Get a piece of foil. Get some tape. Tape's not going to stick real well, okay, because it's, you know, there's probably going to be a lot of blood. Okay? Plastic water bottle, cut it apart. Anything to seal that hole so air can't come in and out. Okay? That's what this stops. This is a commercial chest seal for a puncture wound. Okay? Now I recommend that everyone, if you ride, get yourself an IFAK. Put it somewhere on your bike. Okay? If you carry a backpack, you know, you have a center pack on your tank, you carry a backpack, you know, if nothing else, if you have a leather jacket, okay? I know guys who used to, and they didn't do it for carry medical supplies, but they had extra pockets sewn into their jacket all over the place. They were carrying other things. Sometimes, you know, I mean, be honest, my leather jacket has a holster sewn into it. Nice. Right
Is
here.
it something to seal a hole, something to poke a hole?
Right. You know, absolutely. My leather jacket, well, I get my little, you know, I had it specially made, you know, and it's sewn into my leather. So I don't have to carry an extra holster. If I'm wearing, it's in. You'll never know it. Okay? If you don't want to carry one of these little pads, they're all about this same size right here, an IFAK, because it's got everything. It's got an extra tourniquet. It's got, you know, we tear this apart, put it back together for them. Trauma dressing. This little vacuum packed dressing will blow up to damn near the size of that Dunkin' Donuts box. Okay? And it will absorb as much as that Dunkin' Donuts box you can stick in. Okay? But it doesn't have, let's see. You'll take that and this. Duct tape really is good for everything. It really is. It was either this or Grady tape. Grady tape was better than duct tape, by the way. Grady tape is, used to call it 90-mile-an-hour tape. We used to fix our bumpers and our windshields with the Grady tape. It was cloth, heavy-duty tape that would fix an ambulance while you're going down the road. Kid you not. But duct tape, Alabama fender fixer. Wrap it around. Take this right here, open it up, wrap it around that wound, that laceration, hold it, compression dressing, duct tape, tape it tight. You can't tape it tight enough, okay? Because by the time, again, you're gonna get to the ER, yeah, as long, the fingers may be a little dusky and purple because you're cutting off circulation, but you're not bleeding out, okay? All right, broken bones. Somebody asked me earlier about compound fractures. What is a compound fracture? A bone sticking out of the skin. They said, well, should I pull it straight to, put that bone back in? So, I'll deny I said this. But if you're straightening that leg, okay, to splint it, and that bone just happens to drop back in, so be it. Don't freak out over it.
Don't pull it back out.
Don't pull it back out. Okay? What you really want to feel, so you break your forearm. I got a bone sticking out here. Okay? Do I have a pulse? Do I feel his pulse? That bone's angulated out here this way, and I have a pulse. I'm going to splint it in position. I'm going to leave it the way it is and splint it. Okay? If there is no pulse, I'm going to try and pull on it until I can get a pulse. Okay? Because without a pulse, that limb will die. Okay? More so than with a tourniquet, with anything else, you got no blood flow. Okay? All that blood that was in is still flowing out. Okay? You want to get that pulse back. As long as you can stop the bleeding. Does that make sense?
Yeah.
Okay?
Can't stop bleeding, you won't have a pulse.
Right. So, write a call. Get on a dirt bike. 15 years old. And he was cutting it up. They said he was doing great till that last little turn back to the barn. Came down, landed. He landed, and they said the bike landed on him somehow, but his elbow was sticking out from here to there, and this was this way. 6 inches.
Yes.
Okay? Didn't have a pulse. Nothing. That arm was blue. We just threw him on the board on the way to the hospital, get the doc on the phone and said, I've given him ketamine. Anyone know what ketamine is?
Tranquilizer.
Yep, it's a tranquilizer. Vitamin K. We used to use it to play with back in the day. Right? Yeah, load him up, ketamine. I tell Doc, I ain't got a pulse. Got 6 inches sticking out. He says, start pulling till you get a pulse and stop. Pulled about 4 inches back in. But what I pulled into the arm was dirt, was mud, was blood. Okay? Kid didn't feel a thing because I gorked him. I'd given him enough ketamine to like him not
He
know.
was in a hole.
Right, he was in the K-hole. Literally, he was in the K-hole. Well, I like that drug because it's great for pain. And as long as you keep them in that position, it's great. It's not like fentanyl, which I can take away your breathing. This just takes you away. Okay? But I put him down. Okay? Till I got a pulse back. Now, if he had been awake and I'm doing that, it would have hurt a lot. Splinted in place. Okay? If you're out here and you're up on the roads, you're up on the tail of the dragon, the back of the dragon, wherever you are, y'all have done the back of the dragon, right?
Oh, yeah.
Okay, all the way up in Virginia?
The best one.
That's awesome. Been there, done that. Bikes wreck all the time. Bones are broken. Load them up if you can. If there's a car coming, load them up in the car. Get them down. Get them down. Meet EMS. They'll do whatever they have to do. If not, you're waiting. Because if you ain't got a phone signal, what are you going to do?
Yeah. Yeah, and if anything should happen up on the mountain, and I'm here, you can always bring them down here and move them out. Because it'll be a lot quicker for them to get here than to get up there.
Yeah.
Yeah.
So, but if you look, we know wrecks happen. There's only 2 bikes. Do I leave you to go get help? Do I leave you to go get help?
No.
Depends
On your training.
Depends on how bad off they are.
Right.
If you have fixed the bleeding and stabilized the brakes and make sure that they are somewhat stable, and that's a relative term. They're talking to you. They're not actively externally bleeding. Okay? They have good pulses. Their mental status is good. By all means, drive down to the closest house and get help. Or drive to wherever you can get cell phone signal and call for help. Okay? But if you're actively bleeding, you're actively altered, or I'm doing CPR on you, and there's like next to no traffic, the chances of you surviving drop drastically. And every 20 minutes, those chances drop another 50%. Okay?
I think luckily up here, there's enough traffic because this is a main highway going to
Right.
Blairsville.
Yeah.
You'll always, I've never been up here when there was nobody. Unless you're
Yeah.
night riders.
The problem we have is, if the guy wants to jump up, says he's okay, then realizes he's not okay.
Yeah,
Then we
look
have
at
to-
Tom.
Yeah,
Tom.
Tom broke his neck and got up and walked.
Yeah,
Like
Tom
that.
broke his C2, was up and moving, and next morning, I was in the hospital already, and he came in the next day, and he was in a halo for 8 months.
Yeah. So I have actually carried folks with broken necks. So broken necks, that's just a broken bone. Okay? It's not a severed spinal cord. Okay? You can have a C2, C3, C4 bone break without spinal cord involvement. Okay? What they'll do is they'll end up going in and putting rods in, and you'll be doing this the rest of your life. Because you won't be able to turn your neck anymore. But you'll be alive.
Yeah, folks in your head like that.
Yeah, will you ride again? Will you ever ride again? I don't know. You ride a sit-up cruiser, you can go like this. You're not gonna ride a sport bike again. All right, but so yeah, I mean, there are people, look, I've had people who have woken up dead because they've hit their head, refused EMS, and the next morning we go out, and that's it, it's over.
Look at what happened to Bob Saget.
Bob Saget, who is that female actress, years ago, was skiing,
Natasha Richardson. The one
Yeah.
who
Yeah,
married-
yeah.
Yep. So, brain bleeds. Look, let me tell you something. You hit your head hard enough, cracks your helmet, you have a concussion.
TBI.
Not necessarily TBI. TBI is where there's residual damage.
Okay.
Okay? Residual, where it alters your personality, causing you to be,
Okay.
drugs do that too. But,
I got a couple of those, man.
So, but concussions won't necessarily alter your personality to be great enough to be a TBI. Okay? A TBI is usually involves hypoxia to the brain, no oxygen to the brain. It involves swelling in the brain or some kind of tissue death in the brain. Concussions just are basically some swelling going on without any tissue death or oxygen deprivation or severe bleeding. Okay, just a little bit of swelling. That's what a concussion is. Now they have grades. You have a minor concussion, grade 1, all the way up to, I think it's a grade 4, where grade 4 was the last guy I ran who did Superman through his windshield had a grade 4 concussion. What that means is that he's unconscious and unresponsive till he decides not to be, and until he decides he wants to kick your ass. I kid you not. Strapped down onto a stretcher with backboard straps and tape, sits up, breaks them, and kicks 3 of our asses in the back of my ambulance.
He was Superman.
Had
Okay.
mine though, right?
Never came to, never spoke, all right, until we actually got the helicopter on site and gave him a paralytic and sedation to keep him down. That's what a grade 4 TBI is going to be. Okay? They never come back, they never really regain consciousness, but they're going to sit up and kick your ass.
Now, was he just flailing?
That was me and
No.
Or was he actually swinging?
Oh, he was swinging. And he connected a couple times. And PD's like, "What do we do?" I said, "Stay the fuck away because you need to let us do it."
Yeah.
I mean, I had him strapped down again, and people sitting on him, doing whatever I had to do. By the time I was done, he had a line here, and 2 lines in his legs. Okay, so when the helicopter landed, they just gave him drugs and knocked his ass out. Happens that way. But he went through the windshield. No seat. Okay, you ready for this? Let's get off the bikes for a second. Biggest factor in his no seatbelt. Where are your seatbelts, please?
How do you squeeze by the airbag?
And the steering wheel.
Didn't go up.
It doesn't. Let me tell you, at that point in time, when you're flying through the windshield, airbags don't matter. Now, number one is here's how airbags work. Airbags inflate and they deflate as fast as they. Have you ever been hit by one?
Yes.
Nope. If you've ever been hit by one and, smack in the face, broke my glasses in half. Okay? And that was in an ambulance wreck. But if you've ever been hit by an airbag, you know how fast it inflates, but as fast as it inflates, it deflates. It's gone. It just, okay, except for the side airbags, they stay up. I don't know why. Okay, but hit that airbag, and I think it was, this one guy was, I don't even know if they're airbags. All I know is that windshield was was out. Literally, it looked as if somebody had cut it, peeled it back as it came through. Last guy ran, what's today? Just today, Sunday. Thursday, ran a guy, got broadsided, wasn't wearing a seatbelt, was thrown to the right side of the car, his body hit the right side of his car and his head, big nice indentation in the windshield over here.
Good God.
Okay? He probably had a grade 3 concussion because repetitive questioning, didn't know where he was, couldn't remember anything that happened. Multiple cuts to the top of his head, multiple bleeding, 3 places broken in his back, blood in his belly. Pelvis was good. Yeah. Okay? No seatbelt.
Hey, I get my car without passing my seatbelt.
Seatbelts.
Bobcat these days, that thing ding, ding, ding.
Ding, ding, ding.
I mean, you know, I know people used to get in, snap their seatbelt, and then get in.
Yeah, just to shut the dinger off.
They got them
Shut
now.
the
You
dinger
can
off.
buy them on Amazon. It's just a blank cartridge that goes
Right.
in it.
You can go cut one off of a junk car and stick it in. Don't do it. Wear your seatbelt.
Yeah.
All right. Get up, stretch your legs. We'll keep going. We'll talk some more about trauma.
Oh yeah, for the late comers,
Oh.
$45. 45. Take care of our man.
Colt 45.
4.5 yards of rolled gauze. That's pretty good. You know, that's more than what, you know, when the little rolls, the flex rolls I carry. So keep this. A sling, you know, I mean, it could be, can be anything and anything you need. So keep it or not. I mean, basically, if somebody broke their arm, you're gonna want to use this triangular bandage. For the love of God, I can't tie one for nothing. I've taken trauma classes for years. I couldn't tie this on you if you paid me $100, $1,000. Maybe actually if you paid me $1,000, I'd figure out how to use it, but it wouldn't be right. So you get, unless you really want to practice with this, I would use that because, why? This will do the same thing.
Let's get a bunch of those.
So you wrap it, tie it here, wrap it around the neck, tie it here. Bring it around,
Or use the duct tape.
Or use the duct tape. Duct tape will hold anything. Okay? Do what? Whatever actually, where did that duct tape go?
It's right there, under the strap.
Oh, okay. So it's here, but this triangle bandage, gauze, tape. I don't know how many times you're gonna use 2 of these.
Hopefully none.
Keep one, hopefully never.
Yeah, right.
Keep one. What is this fair? Okay. And they actually gave you 2.
I've got a whole nother bag in the car that's got
Okay.
all that detail in it too, so.
Second tourniquet, hey, that's awesome. This is very important. Why? Why?
You draw smiley faces and click them.
Times?
Times and dates. The time you put that tourniquet on and the date and your initials. This is important. This is important. Okay, because you may not be with that patient. They're like, well, how? Doc, first thing Doc's gonna ask, how long has this tourniquet been on? Guaranteed. It's dated and it's timed. I didn't put it on, Doc. Bystander did, cop did, first responder did.
One of us would probably write it before.
Yeah, you know, let me tell you, been there, done that. You know, put it up here, and there's a lot of blood. Where else you gonna put it? TQ, time, date.
Splinters?
I mean, if you really want to sit there on the front side of the road and pull out a splinter. Flashlight's good. Syringe.
Hey, we've actually done, we've been in that situation.
That'd be good for
You gotta give it. Gotta give.
Give the chainsaw accident.
Yeah, that's, you know.
8 foot away.
And a splinter flew,
Flew and stuck.
stuck right in
We thought
mine.
it was dead.
Pulled
So,
it out and started squirting blood, and I still had more in there. I was like,
Wow.
I'd say the worst part was when I missed the phone call, he answered when I called back. He said, we're in the ER. I said, okay, what happened? He said, well, there was a chainsaw. And I said, I could hear Danny laughing in the background. I could hear Danny laughing in the background. I said, no, Scott, that's not how you open it. Starting again.
So,
What had
Yeah,
happened was,
what had happened was, yeah, so when I had my first wreck, a little war story, I don't know who it was, some bystander, I'm sitting laying in the ground, I know I'm broke. Because I can't stand up and I'm in pain, I know I'm broken. Some bystander sticking his face over me, he says, can I call somebody? What do I do? You know, or just talking to me. I don't know, let me describe what I used to look like. I had a beard down to here, I had hair down to here, and I was wearing a cut. Picked up, reached up, grabbed him, pulled him in to his face. I said, this is the phone number. First words out of your mouth to this woman better be, he's alive. Or I will come find you. And they were. My mother said the first words out of this guy's mouth were, he's alive. He's hurt, but he's alive. Right?
After, I say that he's notorious for that though, because after an accident, the one he shoulder checked the Escalade, I missed the phone call on that one too, and he sent me a text that said, I'm okay. I said, no, that is not how you're supposed to do this.
So my last accident, I didn't call my wife till I got to my destination 6 hours later. We'll talk about some world of shit.
oh yeah.
I don't know what this would be for.
Turkey baster.
Flavor?
You know, yeah, maybe. It's too small really to do anything else.
You'd have to have water, bottle of water for flushing or something, right?
We could probably do that just in
Yeah, flush your wound out.
Flush your-
Get the rocks out.
Don't do it.
NW30.
Don't do it. Don't flush the wound. You don't know what you're injecting into it. You don't know what you're flushing out. You get a severe enough laceration, right? Got a big wide open cut. And it's really not bleeding. And you take this and you go, whatever's clotted in there, you've just washed away.
Gotcha.
You've just washed away any blood clots, any chance of that, self-healing. Okay? Dirt, that's just dirt. They'll wash it out, in a facility and give you antibiotics in case there's any bacteria or bugs in it. Okay? But don't.
Maybe an eye wash for.
Okay, eye wash now,
There's saline in there.
give me a bottle of water, please. Who here rides with a bottle of water somewhere in their bag? You always drink water, right? Got a knife? Mm-hmm. Poke a hole. Right there in the center. Great water bottles too, to sell with kids, especially when they're ice cold. Kids hate it. But poke a hole in it. So we carry normal saline bottles on our truck. Okay, big heavy duty caps. You can't get a knife through that. But you can get a little knife through the side. Pepper spray people get pepper sprayed all the time. You gotta wash the face off. So I'll poke holes in it and I'll just grab that bottle and copious amounts of water to get something in the eye. As clean as it's gonna get. It's not, it's sterile? Your eye's not sterile.
Plus, you're gonna get it.
This is just as clean as what's going on in your eyes, right? So syringe can go. Now, look at how much room you freed up in here. Put this somewhat back together. Sort of. Here's room here. These need to go on the inside here. Well, no, they can't. They don't fit. But what did we have? Oh. But put it back together. You wanted more room. You wanted stuff in here in the IFAC. If you're going to carry any extra in here, you could get There's something called, blood clotting, blood clotter.
There's two in the top front pocket.
Small.
I don't know if there's, I think it's the blood clot gauze though, it's not actually the powder.
Yeah, this
Blood
is
clot.
the blood clot gauze.
Yeah, I don't actually have the,
So they have,
just the powder.
but they have a roll. It's a little roll with blood clotting impregnated gauze that'll fit in your IFAC. Put that in there. Okay.
Question, if we say you could only fill up a sandwich bag of stuff, what would you put in?
Get the duck out.
Don't forget the knife.
I don't know how big your sandwich bags are, but
This is what I would put in. If I could only carry a sandwich bag. Okay. Blood control, gauze, tourniquet, and a pen. That's all you need. Why? Because what else are you gonna do? You wanna stop the bleeding. Okay, you're forgetting that that's there. Hi. You want to stop the bleeding. You want to stop the bleeding. That's it. That's what you want to do.
And draw.
And what?
And draw.
And draw on them. Smiley face. Draw a smile. If they're not, if they don't have a beard, draw a smiley face on them. Okay? But time it, because you're not going to be with them at the end. Okay? This is it. This is all I would carry. I have a commercial IFAC, but it's got all this same stuff in there, and I ride a big bike with a trunk and saddlebags and whatnot. I got 2 on my boat. All right, but I don't, so I'm not riding a small bike where I don't have I have a lot of room on mine. I'm old, I like my comfort.
I know a lot of us don't wear backpacks at all. A lot of us don't wear backpacks at all. We just shove as much stuff in our suit.
Can you shove this into your pockets? Okay.
I'll probably go under the seat.
Under the seat on most.
That's what I was thinking.
Okay, so if you get separated from your bike went down the cliff, where is
On the whole bike.
Where is this?
Somebody-
I went over the cliff.
Somebody's gonna be down there.
Somebody gonna be down there to pick it up, bring it back to you?
No, the tow truck will, we'll just put it in there.
I'm not gonna be using it on myself.
But, so, this is flat enough to fit in a pocket. So is this. This is almost a damn necessity. And it doesn't have to be a Sharpie. It can be anything that writes. Okay? I mean, Sharpies are the best really because, whoever invented this should be, like, or I wish I had.
Nobel Peace Prize.
Yeah, right. It's a Sharpie. Sharpies write on anything. I mean, anything that writes on anything is good. Nail polish too. That'll write on anything. But this is all you need. And all this will fit in your pocket. This will fit in the jacket you're wearing. Right here. Hell, it'll fit in, your hoodie. This will compress anything you've got. This will stop any bleeding. Wrap this on top of it. Okay? If it's really bleeding bad, you put this on and date it. Time it. Okay? Who didn't see the picture of my ankle that I showed from the gator? So, see if I pull it back in. If I pull it back up, it was there. So, this guy, I transported this guy the way he was. I did, I splinted it a little bit, but I didn't, and I brought it's here somewhere, but the foot was turned so it was all the way up. bottom of his foot was facing his nose. But it was only held on really by some skin and ligaments. There was no bone left.
Is he a pirate now?
No, he still has his foot because the arteries were still intact. He wasn't bleeding.
Yeah, I want to see
But
that.
it had just basically cut right there and it was flipped up. So all I did was flip it back, right? And get it in a position where I could splint it. He was in the K-hole too, by the way, when I moved him. Okay? But even if he hadn't have been, you know, if it's held on just by skin and veins and arteries, just put it back in more of a position, normal position. Take this, because he wasn't bleeding, take this and wrap it, and then wrap this. Grab a couple of sticks off the roadway. Okay, once you get this on, grab a couple of sticks to splint it so it doesn't move. All right. You can get what's called a SAM splint. Okay, a SAM splint is
There's one in there if you want to show.
Is there one in here
Yeah,
too?
Right behind the top of the bag, there's a separate back pocket, there's a SAM splint in there. So that zipper closest to the table right there. Right at the top of the bag, there's another zipper pouch right there, yeah.
Oh man, this bag's got friggin' everything.
Yeah, right?
This is a great bag. This is a bag that, you know, I can carry in my ambulance. The only thing it's missing is my airway kit and my drugs and IV.
What'd that bag run?
The IFAC on the side is like 270. The little bag that had all that stuff is like 275. The bag, the big bag is probably like 3 something. But it comes with.
Yeah, you can go buy that bag for $49.99 at Academy Sports.
Yeah.
You can go on Amazon and start just purchasing piece by piece. There's a company called True Prep out in Marietta that sells all this stuff. You got good, you bought top of the line stuff.
Yeah.
Okay, North American, you know, is
That
you know,
website,
Rescue.
North American Rescue, sells like the legit stuff.
They-
I only bought their stuff because I got it all reimbursed. So.
Right. So if you're just looking to put something together, you can put it together for $100.
And what was that last supplier that you mentioned, True Prep?
True Prep. Where do you live? You live up here or down below?
In, Roswell area.
Marietta. There's a company called True Prep, 41 South, just north of Allgood. Okay, True-Prep, and you can go online. Amazon sells this. Anything, you know, if you go on and you look at all the kits that they sell kits anywhere from $100 to $5,000. Okay, how far do you want to go? How far do you want to play? Okay, this is great if you have the room. Okay, but they also make these that come in rolls about this big. You know, that look like, you know, like this, a little small, you know. So if you want to carry something like that, and you can open it up and roll it around all your stuff. So all you have is one roll. There's no wrong way, there's no right way. There's what you're comfortable with way. What you feel you need. Okay? This bag, you take out what you're not gonna need, what you're gonna need, what you wanna be comfortable with. Okay? The more you ride, the more you see, the more comfortable you get. Like I said, for me personally, I can do anything I need with it. I've been 20 years on the street though. I've seen wrecks, I've seen, you know, all sorts of stuff. Oh, and I can't bend over either. You know, I need to be wearing a brace on my knee. Pick that up, please.
I got guys that pick it up for me.
Right. Let me tell you, when I go to work and I have a patient on the ground, my firefighters know me so well after 6 years. If I get down on the ground, to do, you know, an airway because we're doing CPR and whatnot. Before I get up, there's one firefighter on either side of me helping me up. I'm not kidding. Y'all, I'm not kidding. They help me out. This is what these guys do for me.
Well trained.
They are.
The other
And
thing
good
is,
friends.
if you're carrying stuff, even if you're not gonna use it, someone else might know how to use it.
Right, yeah, and I mean, if you have all this stuff, so if I was out there riding, and you showed up, and there's a bad accident, and I'm out there, and you showed up and say, I got a trauma kit, and I open it, all your shit would be strewn out, and I'd use what I need. Because now I have everything I need. But if you walked up and said, I have this, will this help? You're not heavily bleeding, that's already gone, these 2 pieces. But yeah, these 2 I'll take, and I'll open them and I'll use them. Because this is great for road rash. This is also, if there's like a puncture wound from a stick or a rod or something, hell, we all know there's debris out here on these roads and people leave, you know, I've seen pieces of rod go in through people's legs out on the road. Yeah, we don't pull them out, but we wrap them in place. Don't pull it out, wrap it in place. But if there is a hole there, somebody shoots at you while you're going down the road these days with all this road rage crap, okay? And you have a hole in you, or your buddy's got a hole in you, I would take this right here, I would open it, wherever that hole is, I would start sticking this stuff in by the finger. And then I would wrap it with this. Get 911, I'm done. Okay. That's the same with, you know, you pull that big splinter out of your hand, shit, shove some of this in there, right? It's a hole, it's a puncture wound, shove it in there. Sounds gross, but it'll stop it.
Okay? Apply pressure.
So in other words, like I said, on a puncture wound, sometimes pressure doesn't work.
I didn't take my hand off until I.
So, for instance, look, you ready? I get cut right here, my brachial artery, and I'm applying pressure. I can't apply enough pressure to stop that internal bleeding.
Now, could you shove your thumb up here and try to hold the artery as much as you could?
You shove your thumb up into that artery like that, when I show up, I'm gonna put a tourniquet on, and yes.
Well, but it'll get you by though to try, if you don't have a tourniquet,
Sure.
shove.
Absolutely. You know, but you gotta get it just, you know, stop the bleed however you can. You know, there's a, you know, if you watch, go on, you know, there's a whole program out there called Stop the Bleed for when we're having all these school shootings. There's a program that we teach the kids and the teachers called Stop the Bleed. If somebody gets shot, doesn't matter where they're shot, that's what we want to do, is stop the bleeding. Because if we can stop the bleeding, they'll survive. This is survivability doubles. Okay, especially in traumatic, in GSWs. We all know somebody wrecks a bike, they go down, how many times do they roll? Once, twice, 3, 6.
Check Danny's video.
It depends. Sometimes you don't roll.
Yeah, watch the videos. Watch the videos. Okay? So, let's see. Oh, here's that ankle. Okay? You might even come up and look at it. But it's there, you know, you see it. You know.
Oh my
Right? That whole foot was,
God. Yeah, I gotta get thrown up.
I mean, this is what you see out here.
Yeah.
Boots or no boots? How many here ride in high boots? You ever get on your bike and not ride in high boots?
No, absolutely not.
Okay. You know, I have friends of mine who ride in sneakers.
Oh, yeah.
I'm like,
Oh, yeah, 30 years ago, yeah, I was dumb. Yeah. Don't worry.
I have friends, look, I have friends today who still ride sneakers. I always wear a pair of steel-toed lace-up boots, and I never ride in shorts, and I never ride without a cut. I might ride sleeveless, but I always have my, cut leather on up top. Okay.
Unrelated question. What are like some big mistakes people make when doing either CPR or trauma stuff that we should be
Try and move the patient.
Okay.
Okay, the only time you should ever try and move the patient is if you're in danger.
If you're
So
what?
you're in the middle of the roadway,
Oh, okay.
okay, you need to move aside because there is traffic coming. And it's just, there's nobody there to block for you because these people in cars don't care about you.
They're looking this way.
Right.
At the views of the trees of the.
There you go, they don't give a shit.
Yeah.
You've seen it. You've seen
around
it.
the corner.
Yeah, you've seen it. Get out of danger. If they're on the side of a, hanging down, we all know that there's some nice drop-offs. Can you get them up safely? Okay, if you can, that's fine. But number one mistake I see everyone making is putting themselves in danger. I gotta say to my buddy. Buddy's gone down, and he's gone down bad enough. It sucks. People die. I've been doing this for 20 years, and I haven't been able to save everybody I've tried to. Okay? I've ridden with a couple guys who've been down bad enough, gotten hurt bad enough to die. Don't put yourself in danger. If you can, move the patient safely. If you can't move the patient, do what you can. Okay? But don't get yourself hurt. And don't try and be a hero. I hate to say this because if you get hurt, the accident's bad enough, they're already gone. Okay? I don't know if any of y'all, I don't know if any of y'all have ever experienced it. Okay? God forbid you should. But if you have, they're already gone. Okay? Do what you can to protect yourself and everyone else with you. That's the biggest mistake I see people make.
Getting themselves hurt.
Getting yourself hurt because you're trying to help somebody else.
Yeah, we had a bad one this last summer. It was Harvard.
Yeah, that was not a pretty scene.
Emily and I were over at
Yeah.
And he was passed when you got there.
Yeah, well, the people that were in the truck, they actually got out and tried helping, because it was a nasty scene. And, as fast as they were pumping his chest, he was going down.
So,
Yeah, it was pretty nasty.
Even if you'd been able to get a tourniquet on, there's some places you can't stop the bleeding from.
Had notes.
Here and here. One other thing, I worked a really bad one on Highway 41. Sport bike rider, drive out tag, tried to beat an 18-wheeler making a turn.
No one beats an 18-wheeler.
No one beats a car, no one beats an 18-wheeler, and no one beats a train.
Trains are facing out a little bit better.
Or a MARTA bus.
Or
I think the biggest task that we face, being up here, is trying to keep the rider still. They want to get up and, I've seen it so many times where, they stand up and they say, oh, my back hurts, and come to find out they broke their back, and, that's the biggest thing that because they want to get up. I think it's more of an ego thing.
So, biggest thing is now, we used to, for years, if you were in an accident, it didn't matter, car accident, bike accident, a fall, these long backboards that we used to carry, we'd put you on it and strap your ass down to it. We didn't care if you wanted to be on it or not, because that's the way things were done. Period, end story. Now, if you're able to get up, I'm gonna let you sit up slowly. Every time you move, I'm gonna ask you, have any numbness or tingling to your fingers or your toes? Well, when you start having numbness or tingling to your fingers or your toes, you need to stop. Quit moving. Something's not right. So if they're able to get up, let them get up. Okay? Because if there's going to be any damage done, the damage to that spinal cord is going to happen almost immediately within that wreck. Okay? Within them going down and then rolling and twisting and whatnot. That spinal cord damage is going to happen then. There'll be some residual swelling later, maybe. Okay, where they may lose a little bit of feeling in their fingers or their toes, but the cord is not severed, the cord is not damaged. I can't guarantee you that if they're able to get up, they'll be okay. But I guarantee you, if they're gonna wanna get up, and they're gonna wanna say, no, I'm fine, keep your hands off of me. Keep your hands, you know, okay, I'm here to help you if you need it. Okay, and just watch it. Because if there's something really bad inside, they're not going to last long standing up. They will go back down. Okay? And that goes for what I do too. I've had patients who, no, I'm fine. Let me get up. Keep your hands off of me. Well, number one is, you know who you are, you know where you are, you know what time of day it is.
How many quarters in a dollar?
How many quarters in $1.50? If I put my hands on you and you tell me no, I've now assaulted you. That is now assault. Okay? You push it hard enough, they push it hard enough, you can be in trouble. You know, I've had people tell me, get your hands off me, don't touch me. See you, bye. Hope you're okay. In uniform, do me a favor, what's your name? F you, go away. Patient refused all care, patient was belligerent and combative. We'll take 5 steps back and wait 15 minutes before we go unconscious, then we'll take care of it. Kid you not, that's the way it goes. All right, don't help somebody who's wanting to get up, let them get up. Just watch them, make sure they're okay. They're not going very far, the bike's trashed, right? You know, they'll be there for a while. You know, after a while, that adrenaline will wear off, and they'll be like, you know, I don't quite feel so good. Right? Hey, can I call you an ambulance? Okay? Don't push. If they're awake and alert, and they're able to move, let them get up. You'll know if they're broken. You know, I mean, we all know that anyone who goes down, if you haven't been trained, if you don't cross your legs when you're rolling across that ground, one of them legs is going to be broken. We've all seen it, right? When you go down and you cross your legs, do you think about it?
I'm still holding onto the bike.
Hell to the no. If I'm going down, I don't want that bike near me. I'm pushing away.
I've been wide open the whole way, sliding on the ground.
I'm
gonna recover.
You're gonna get up, it's gonna slide back up, and you're gonna go. Well, yeah. So, nope, I want that bike away from me.
And we tend to hang on to it.
Well, they have lighter bikes though.
Do what?
They have lighter bikes. You're on a Harley. That thing's heavy.
It ain't 800
I mean,
pounds.
400 pounds still, that's
You know what? Yeah, 400 pounds ain't gonna pick up that.
Oh, I'm sorry, guys.
So, but my 800 pounds fully loaded easily. You know, between all my leather, all my gear, I throw shit in my back. I forget about it. I have tools in there. Can I pick it up? Yeah, I can pick it up. Have I dropped it? Yeah, I've dropped it. Have I gotten rear-ended and ridden in Noonan and ridden to Florida? Yeah, I've done that too, okay? But, you know, and yes, I was broke on that, but I didn't know it till I got home. You know,
Yeah, those 2 or 3 days later, it hits you.
well, it hit me when I got down there that my neck was just not right. You know, 2 bulging discs later, 4 cortisone shots. Forever numb in these 3 fingers. You're gonna ride, you're gonna go down. You can drive a car for 50 years, never have an accident. You've been lucky. The law of averages says you drive, you will wreck. Not necessarily your fault, but you'll have an accident the more you drive. The more you ride, you'll go down. You just have to be prepared for it. That's why you take the classes. That's why you do the classes that he's doing. Okay? The road work. Okay? Whatever you know, group you're riding with, and doing the road work to make sure. I've been out on the street since I was, 15 years old on a bike, and I'm almost 60. I had my first bike when I was 12. Went to jail because I rode the street.
As a 12-year-old?
As a 12-year-old, they took me to the mile because we had our enduros riding down Roswell Road. Got pulled. We tried to run. We didn't get very far. I called my father. My father pulled the spark plug and wouldn't give wires and wouldn't give it back to me for a month. But he came back and I rode again.
You were just into the bike life before it was cool.
Yeah, I've been into bikes forever. It's great. You're into the bike life. Work it. Okay? But practice it, know it, be prepared for it. Any more questions? Trauma's trauma. Remember this. Blood stays in and goes round and round. Heart stops, we pump till they start moving again, or we can't pump anymore. Questions? Comments? Hate email? Yes, no? We'll go through your bag and play with that here in a minute. We're gonna get through everything. There's stuff in there that 20 years out on the street, I've never used. And I carry all that stuff.
I have a question. Say that we, see an accident happen, or we see someone on the side of the road. What's like the checklist to do? Like,
Okay. Number one is, do I have a duty to stop? No, you don't have a duty to stop. Okay, you're not professionals. You don't have a duty to stop. Am I going to stop? That's different. You're protecting, all of y'all are protected under the Good Samaritan law. Even myself, I'm off duty. I'm protected by the Good Samaritan law here in Georgia. So basically the checklist is, you pull up, they're down. Hey, just talk to them. Are you heard? And you notice that they don't know who they are. They don't know where they are. They don't remember what happened. It's a good possibility there's an issue. Okay, is it medical? Are they diabetic? Did they hit their head? Or is it trauma? Did they hit their head? Are they having some kind of breathing issue? Why did they stop? Why are they down? Why is their bike laid over? Okay, so just you ready? Sense is not common. Use common sense. Use common sense when you're riding. Use common sense when you stop to help somebody. Some people who are pulled over don't want help. It's a true story. Okay? You pull over to help somebody and say, nope, we're fine. Okay. Just trying to be courteous. Ride on. It's like somebody, you know, who goes down, hey, I'm a medic, can I help you? And they say, no, don't help me. Can I touch them? No, I can't. Can I talk to them and explain what's going on? Yes, I can. But unless you saw something, you know, use common sense. Did I answer your question? Just use common sense. And be aware, because, you know, you don't know why they pulled over. You have no idea. You know, police officer will tell you he'll never come out not being aware, not looking at everything that's happening when he pulls up. We have tunnel vision. Well, I don't, because I've learned over the years, but y'all would have. All you see is something happened. I'm there to help. But you're not looking, you know, at the big picture. Why did they pull over? Do they look like they need help? Are they okay? Are they waving as you drive by? Or they're waving as you know, and most people most people on bikes don't stand there with their back to traffic when they're off their bike. Unless they're working on the bike doing something. Most people don't. They're always looking at traffic. Because we're well aware of what the cars will do to us. So if you pull up and wave, hey, yep, nope, good.
Yeah, that's what I was gonna say. Most of us up here, you know, if we see somebody pulled over, we give them the thumbs up. If they give us a thumbs up,
Boom off. You know. And up here, they'll let you know if they need help. You're riding by my head. Help me. They will let you know. Because, you know, people who ride are good about that. Whether you're up here, whether you're in the city. If you ride and been riding for more than 30 days, you know, not like some of these guys who are, you know, in the city of Atlanta riding for 30 days, selling their bikes, buying bikes, selling them, you know, buying a bike because it's cool, wrecking it, selling it, doing it again, you know, that's what it is. But if you've been riding for any time and you are a rider, you know, no, good, they'll let you know if they need help or not. We're headed to Panama City Beach all the time. You know, people pull over all the time. You know, you're the first people to come up, waving. You know, if they need help, they'll let you know. Most of the time, there's usually, you know, they don't pull over because their ass hurts.
So I do got something that gets brought up a lot, so a lot of people ask, so when somebody crashes, go down and you know they're injured, why not give them water?
So if they're injured and we don't give water because we don't know the extent of their internal injuries, okay? For one. Two, if they need to go to surgery or they're really badly injured, if we put anything down into their stomach, they're gonna vomit. Because that adrenaline will wear off, cause nausea. You know, the body's gonna dump adrenaline when you go down. When that adrenaline wears off, we've all had that, you know, ass puckering scare, and our bodies all of a sudden, then we come down from that large dose of adrenaline, we're nauseated. If there's anything in our stomach, we're gonna vomit. And if we're unable to control our airway, like I'm talking to you now, and I'm just kind of altered, I'm on the verge of passing out, I'm gonna inhale into my lungs. And then I'm gonna cause a breathing issue on top of the trauma. Okay? Now you can give them a little something to wet their lips, just a touch. That's about it. But don't give them anything to drink.
And I knew it, but it gets brought up on our page, that, you know, so, you know, and I've actually been on the site where they're like, you know, here's your water, and I will give water, they're saying they're hurting with water, but that is something that gets brought up on the page, and I know you probably should do that.
Yeah.
So respond to it, say, because what happens is in that trauma, you know, as things settle down, everyone will become nauseated. And if there's anything in their stomach it's gonna come up and it's gonna come out. It just will. If you ate, most people go into cardiac arrest when? Right after they eat. And let me tell you something, it's not pretty and it's messy. I will never eat SpaghettiOs because of it. Okay?
My dad doesn't eat hot dogs for the same reason.
Yeah, I'll never touch SpaghettiOs again. But adrenaline rushes, adrenaline, nausea, trauma, nausea, they get nauseated, they get swimmy headed, they're gonna vomit. Once they vomit, you want that stomach acid goes down into the trachea and into the lungs. Acute respiratory distress disorder. That'll kill you faster than anything else. Because you're just now taking that stomach acid and burning your trachea and your lungs.
So, I think last time we talked a bit about CAD and just like basic assessment
Okay.
once we're on the scene.
Okay, circulation, airway, breathing is what CAP stands for. Okay, when I walk up to you, I want to know, are you bleeding anywhere? Do I see this right? Are you bleeding? I want to stop the bleeding. Again, remember, stop the bleeding. Okay, because even if they are in cardiac arrest but they're bleeding, if you see that blood coming from somewhere, it doesn't matter how much I push on your chest, okay? If that blood's flowing out of you, you're done, okay? So it's circulation, all right? Are they bleeding anywhere? Do they have a pulse, okay? Check here, check the neck. You always touch here, right here. They've got good radial. If they've got a good radial pulse, they have a good blood pressure. For one, they may be unconscious, but if you can feel a pulse right here, their blood pressure is at least 90, which I'll take any day for an unconscious patient. If you feel here, and they have a pulse, that's good, probably about a 40. But I'll still take it. I can work with that. I can work with that. Okay? So circulation, bleeding, pulses. The next is airway. Were they choking beforehand? Is there something lodged in their airway? Did they vomit? Do you see vomit in their mouth? Turn them on their side. You know, never stick your fingers in somebody's mouth and try to clear their airway. Never, don't do it. Why? You may lose a finger. You lose a finger. You just stick something in their mouth and you go, there goes your fingers. Or, what you can do is whatever's in their mouth, you can push it back down into their airway when they just finish coughing it up or trying to get it up. Okay? So look at their airway. If they're vomiting, is there blood in it, whatnot. So you have, they're bleeding out, stop the bleeding. If they have no pulse, okay, in their airway, check their airway. There's nothing in their airway except for blood and vomit. Lay them on their side, try and, pat their back, get it out, roll them back over. Compressions. Okay? Start compressions if there's no pulse. They're not responding. Okay? Push on their chest till either they start responding or you can't go anymore until help arrives. Okay? Basic assessment. So basic assessment is, hey, I walk up, how you doing, what's your name?
Danny.
Hey, Danny. Bob, right, Bob? Right.
There
So,
you go.
Danny, how are you? You okay, Danny?
Good.
Good. You know what year it is?
2022.
Okay.
That's me.
All right, you know who the president is?
Yeah.
Here, no. Do you know where you are?
Yes. What about
Okay. All right, how many quarters in $1.50?
7?
Let's go to the hospital. You're altered. Okay?
We're just done.
Yeah, I don't know well enough to say that.
Who carries quarters?
Hey. Car wash.
There you go.
I got two. I spend cash. I carry cash. I don't always. I like cash. I'm still old.
Cash is king.
Cash will get you more. Cash will get you more.
Cash out.
Somebody said, "Do you have Cash App?" Yeah, my pocket is right here. Paper. That's my Cash App. Man, my kids know nothing about cash. Nothing.
Yeah. Michael said, "What's the dollar?"
It's a dollar. I didn't teach. You know, they don't teach it in school anymore. They don't teach cash in high school anymore. Anyway, so basic assessment is, can you talk to me? Can you tell me who you are? Can you tell me where you are? Can you tell me what happened? But my first question always is, hey, my name's so-and-so, can I help you? No, I don't want any help. See you. Take a step back. You know, I saw you just had a pretty good wreck. You know, I mean, can I get you anything? Can I take you anywhere? Can I call somebody? Nope, I'm good. You don't know what's going on? Get gone. Why? Self-preservation. I walk up and says, hey, how are you? Oh, man, I just had that nasty wreck. Did you see it? Yeah, I saw you wreck. Are you okay? Yeah, I'm sore everywhere. I hurt. Well, okay. Is there anything I can help you with? You want to sit down? You okay? You know, do you know where and then you feed it, you know where you are? Remember what happened? Can I call for help? Okay? Because there's only so much we can do. But now they're on the ground, CAB, basic assessment, talk to them, are they bleeding, are they breathing, you know, because they have a pulse. Are they broken somehow, some way? Get help. So, biggest thing again, what did I tell you before? What's not common? Sense. Sense is not common.
I got a small follow-up to that. So most of us know not to try to remove somebody's helmet, but is there any situation in which that would be appropriate?
Yes. There's a way to remove a helmet. But it takes two people. Okay? They have not removed their helmet prior to. Okay? It takes two people to remove a helmet. Okay? Especially if they're laying on the ground. All right? Got a full face? Somewhere here?
Yeah.
Whose is that?
Don't, just mine, we'll get that.
Put it on. Yes, put it on.
Before you take it off, what would be the circumstance where you would want to take it off?
Vomit in the airway. They can't control their own breathing. Okay. You know, or there's blood. You see blood coming out from underneath the helmet. Okay. All right.
All right.
So who's tall? Here. So
Well, that's a fancy strap. We're gonna have to cut that off.
yeah, right here. So we turn. So what we're gonna do is, you're laying on the ground. He's laying on the ground, right? No, because I'm not getting down because I ain't gonna get back up off this concrete floor.
We can raise that up.
Yeah, we're good. Pretend you're laying. He's on the ground. I'm kneeling next to him. All right. I'm gonna take my hand and I'm gonna wrap it around his neck like this, and you're gonna undo the strap. Okay. Now.
So there.
All right.
You're unconscious. You're not.
So I'm holding, he's on the ground, so basically that helmet's holding up the back of his head, and I'm holding him from going left to right. Okay? Now, if go behind him, and he's at the top of his head, okay, lift the helmet straight off, slow. Okay, slow, stop. There we go, as little movement.
He's got a big nose.
As possible. As little movement as possible.
It's like an alien being birthed.
Okay. There goes his hearing aids.
Yeah, that's all right. I got it.
Okay, with as little movement as possible. Now, I've got the airway, I can control any bleeding. But you see where my hands are. I'm not letting go of his head.
Can we see where your fingers are at?
And the whole time
Okay.
he's doing that, he's just slowly
Work your
creeping
hands
up.
up.
Right, I'm
Yeah.
slowly moving my hands up. Now, what's gonna happen is you're at his head on the ground, you're gonna take your hands, and you're gonna bring your hands around his ears, and you're gonna hold it right there. My hands are now free.
So what would that look like if he was on the ground? Obviously, he could be behind him.
He'd probably be like right here.
Right here, my hands, right here. He's on the ground, my knees around his head.
Yeah,
So
that's
don't
what-
get me wrong, if this was real, I'd be on the ground in 2 seconds.
That was,
Yeah,
so
so,
the whole time, I was trying to move my hand, his hands wouldn't
Yeah.
happen.
Now, I know my Arai, the G tags have full tags.
Yeah, the red.
so
Red tag.
there are also, yeah, you know,
What just happened there?
there's multiple types of helmets,
Yeah.
okay? You ready? See that?
Hearing aids.
See that right there? It's rounded. Why is it rounded? So when I stick it under the strap of the helmet, it's not sticking the patient in the skin. And I cut the helmet with the strap. I'm sorry, helmets can be replaced.
Oh, yeah.
If I'm on the ground, I'm probably replacing it anyway.
Leather suits.
Right, yeah, if it hits the ground, you should replace it anyway. You know, okay, I wear one of them little lightweight ones when I had my last accident, I still wear the damn thing.
Do as you say, not as you do.
As I say, not as I do. I'm old, I don't care. I'm gonna die somehow, some way. Okay? But I'm gonna cut the strap if I can't get it off. Because there are some straps out there, I'll be honest, I have no clue how to use. But if I'm on the ground, I'm holding my hands right here, okay? I'm holding him as far as I can get my fingers in underneath that helmet and holding his chin, all right? And holding that head up, so as that helmet comes off, I'm gonna move my hands up, and then how that helmet's gonna go away, and the person who's pulling the helmet is gonna take their hands and wrap them around and stop that head from moving, okay? I'm gonna maintain cervical spine, C-spine. And at that point, if that head's cocked, I'm gonna go slow and easy until they start screaming or hollering or saying nothing. Okay? And put it back into inline neutral, right here. Okay, and then whoever's behind is gonna hold that and not let go until you tell them. Once your hands are on that head, if there's more than 2 of you, or just 2 of you, that one person holding that head stays right there holding that head. Okay? All right. Now, some of these have the big thing that flips off.
Yeah.
I can see your airway. I can talk to you. You know, I can take a piece of tape and I can, you know, tape it back so it won't fall down. Like, break it off. I've done that. We've done that before. We've broken it off. Okay.
I see that.
Football players, these kids now, all right? All of the trainers carry screwdrivers, power screwdrivers. The moment this kid is down on the field and they think it may be a neck injury, shoot, boom, boom, 1, 2, 3, 4, 5, 6, that face mask comes off. And we, you know, as long as I can see your airway and I don't have any bleeding coming out of your helmet, a lot of blood, you can leave it on. Okay? But if you're wearing a full face and that piece right there, and you know, I see, you know, granted there's bits of teeth or lip or something, you know, something in there. You really kind of want that helmet on. And more than likely, if they're semi-conscious, whatever, they're going to be trying to peel it off anyway. Most people are. Okay. What else we cover?
Anybody have any experience or benefits of the neck braces? Which they're usually on a racetrack, but.
The airbag vest with the,
Well, not the
C-spine
vest, but-
support?
The little collars
Yeah,
that
the
people
collars that
will
you
wear.
Yeah, the off-roaders wear those.
Yeah, I guess more of them.
I've never seen it. The only time I've ever seen was the guys in NASCAR wear that big collar now.
Yeah, drag race.
The drag racers. Why?
You're
Because
talking
of
about
Dale. Why? Because of Dale Earnhardt.
Because of his G's and.
Yeah.
The Hans device.
Dale Earnhardt, when he
Yep.
hit that wall, snapped his neck.
Yep.
If he'd been wearing one of those braces, he'd still be alive today.
Only reason I ask is that, I mean, you know, I'm older, you're old, you know, don't have quite the flexibility that I once did. Is that gonna help keep a neck injury from being as severe?
Yeah.
That's my answer.
Just curious.
IDK. All right.
Yeah.
I mean, you know, what's gonna help keep you safe more than anything else?
Good
Situational awareness.
Good judgment.
Good judgment, situational
Common
awareness,
sense, yeah.
common sense.
So the other thing to check if you're coming up on a unconscious patient is to check for medical or bracelets or anything,
Yeah.
necklaces.
Yep. That too.
Yeah.
You know, but you know, again, you're right, common sense says, oh, look, they're breaking, oh, it doesn't mean shit, you know. But it may, they're diabetic. But then again, how you gonna check? If they're diabetic, what are you gonna do?
Normal stuff first, then check for anything extra.
Yeah, you know, because if they're unconscious as a diabetic, you know, they need EMS.
Look for a bracelet.
Yeah,
Yeah,
bracelet,
look for a
necklaces,
bracelet, necklace.
tattoos, you know, inside right here.
Yeah.
Got a friend of mine who, she's tattooed, says diabetes, type 1, check my sugar. That's exactly what it says.
Yeah, well, I used to have a fistula, so you can't do anything on this arm anymore, right? So I thought about getting a tattoo about that too.
Yeah.
There's been a time or two I've been unconscious, life-flighted.
Yeah, so if you've had a fistula, you should probably have a bracelet or something, or somebody.
Well,
with
it's
you.
gone now, but you can't put in a needle.
Still can't put the needle in there
Yeah.
because everything's compromised. I can't take a blood pressure in that arm because everything's compromised.
Right.
Okay, so you should have something, a bracelet on that arm, or, you know, previous fistula, you know,
Check other arm.
or put no IV, no BP,
No needle, yeah.
you know.
Check other arm.
Arm sucks, try the other.
Yeah, I'm sorry, try the other. Listen, I can stick a stone and get blood from it. So, okay. Any more questions? Want to hear anything else? I can give you some more information, anything you want. Like I said, you know, again, there's 3 things that you need to always be aware of. Yourself, your surroundings, other people. Those 3 things will keep you safer than anything else. Okay? I've walked into situations where, you know, I should never have walked in on as, you know, as a medical provider. Okay, by myself. But we were never given a heads up. There have been times, you know, you've heard, you know, what was it, those guys that went out were held hostage. There's been a couple other times people have been held hostage in surrounding counties. It wasn't publicized like that one was. Okay?
Most of them say domestic violence is the worst case.
I won't
Yeah,
ever,
they
you know,
go
I
out.
won't go in on that. That's the worst.
Yeah, they
I
say
will
it's the
never
worst
go
one
in on a
ever.
domestic violence case. Now, I've had people, a woman run her husband over on his motorcycle. Ran, hit him in the ass end, and thank God he was okay. But, you know, it was a motorcycle accident. That's what we were called out for. Comes to find out, he ran his ass over for cheating on him.
You know, generally speaking, if I'm alone, I'm not gonna stop to render aid in most situations because being a lone female, I'm at a disadvantage already.
So number 1 is, as a lone rider, if a situation doesn't look right, it ain't right. Okay? I see an accident, nothing I see a bike, something, I'm gonna go for help anyway, call for help and then come back. Why? Because what can you do, one person? What are you gonna be able to do? You know, I don't have a phone signal, I can't get help.
It's a bad situation being.
It's a bad situation being. I ride alone a lot. I ride up in these hills alone a lot. I go down and I go over that cliff. You ain't finding me. The only thing that I have on my side is that when I leave the house, my kids and or my wife knows where I'm headed and where, you know, and where I'm headed to and how I'm getting there.
I got an app on my phone called Moonlight, and it runs in the background, and if it detects an accident, it will actually notify the local emergency services, and it works.
What if there's no service?
So that's the thing. Yeah, I was up in the hills, and yeah, you have to have service for it, but in the chance that you do have service and you've been separated from your bike or you're unconscious, it did work. They tried to call me, didn't get a response, and then EMS showed up.
Yeah. So I have something called Life 360 on my phone because I have it for my kids. Okay. I know where all three of my kids are 24/7. Even my 19-year-old, he hates it, but you know, I told him, I said, you're gonna be traveling with work. I want to know where the fuck you are.
Yeah.
Okay. So I have Life 360 on my phone. My wife has it on hers. If I go for a ride and I'm out, hey, this is where I'm going. She goes, I got Life 360, yeah, but you don't know where I'm headed. This is where I'm going. Now one day my bike, you know, I had a flat tire and had no service. She finally, you know, got somebody to come out and check on me because my Life 360 had stopped in the middle of friggin' nowhere for longer than it should have. You know, she called somebody and they came out and looked, and, you know, sure enough, that flat tire, my father-in-law pulls up. It's like, yeah, I figured you'd get here eventually. She goes, yeah, you know, Amber called, says, you know, go check, you know. And I was an hour away from his house, 2 hours from mine. Okay?
I think that's actually how they got out there on the Dragon survived. He crashed went off the hill. They tracked it down by the Lobster 68.
Yep.
How much does that cost them?
We have, it's a free,
I don't think.
we have the free part. I don't do the pay part. I mean, the pay part though, we'll track how fast you're going. I mean, there's all sorts of stuff.
You just need the basic. I'm gonna tell you what we're at.
Okay. I mean,
Yeah, a lot of people really want to know how fast we're going.
I mean, and it works. It's great.
I mean, it really does do a good job of pinpointing or something like that.
So there you go. So this is
Also location.
my wife.
Again, I've been talking about whether or not we need to do something like that because a recent incident made us think. In general, we don't care if it's something wrong, but if we did.
It's a pretty good idea. That was
GPS these days is awesome. It tells you I'm at Vinny's Speed Shop.
Yeah.
So, and it's Life 360. I don't pay for it. I don't pay anything for it.
Yeah, I'll have to look at that because it's I do the same thing with my person.
Yeah, but it doesn't call anybody. This won't call anybody unless you pay for it. You know, this is one of those where you have to pay for the enhancements.
We brought up smartwatches also. They've got the fall detection on them now too.
Yeah. I mean, you know, maybe, the newer ones do.
Yeah, the newer ones
They
do.
know ones that they're type on and stuff.
Yeah,
I mean, I have a Garmin that'll do it. Has like an emergency feature that you have to hold button down.
So, yeah, if I have I could put cell service on this watch, but I just have Bluetooth, because, I'm never, my phone's
Yeah.
never far from me. So, I mean, I could put cell service on this and type on my watch. But if I don't have cell service in the mountains up here, it means nothing. I mean, when I broke down, I was in Alabama, in the northwest corner of Alabama, and there's no service. The only reason that she found me was because as I left the service area, my Life 360 stopped responding. But she also knows to watch and see, like, am I gonna come out on the other side, and all of a sudden it's gonna be from here to here, when it doesn't show up in 2 hours.
You know, those phone companies too. AT&T does it too, like, you can go on their app and update, if you're having trouble with your service, you can go on there and let AT&T know. And also with Verizon, you can hit star 228, and it updates your roaming capabilities. And what it does is it pings you to different towers that are around. So you got just, if you do star 228 on Verizon, it updates your.
Yeah, on T-Mobile, you either have roam feature, which doesn't matter whose tower it is, if you're on roam, okay, it'll hit that tower.
Right.
The closest tower it is.
So sometimes you gotta turn it on, make sure it's on.
Oh, yeah,
I mean, mine stays on, but a lot of people like, I don't know that on, but.
right.
Really?
Mine stays on too because of the way I travel and the way I do things.
Well, it does,
So,
but that
yeah.
Verizon really works good, that structure.
So, yeah, that's a good thing. So, questions? All right, while y'all talk for a second, I gotta go pee. Think of any questions, I'll be right back.